are in 16 districts of Malawi. In the northern region, we are in Chitipa, Karonga, and Kadabe. In central region, we were in Nkota, Salima, Dowa, Kasungu, Lilongwe, Mchinji, and Cheu. In the south, we are in Chikwawa, Mulanje, Zomba, Machinga, Balaka, and Mangochi. So in all these districts, we did a number of services. We started with the clinical services to make sure that people access essential health services. Just a snapshot of what has happened. We were concentrating on child health. At the beginning of the project, we did a baseline survey just to see where we were. We noticed that 74% of the facilities were providing child health services. But through support of the project, you can see most of the services are nearly at 100%, except for maternal health and kangaroo care. That's where we started from. In terms of child health, we were supporting vaccination against measles and rubella, including DPT. So we've managed to support more than 540,000 children to be vaccinated. In terms of diarrhea, as you know that diarrhea is one of the major causes of childhood mortality. We also supported the training and the access to treatment of 1.6 million children who got treated with diarrhea. But we noticed that not all communities in Malawi have access to health services. You know, we haven't reached the policy of 80 kilometers to your facility. So we also encourage village clinics where 88% of children receive the services. Looking at family planning, we also did a lot. We were working together with our partner Bajala Sogoro. So through outreach clinics and facility clinics, we've managed to generate 3.8 couple years of protection. Basically, BLM was focusing on the youth, looking at teenage pregnancies and all that. So we've managed to reach more than 305,000 youth that accessed family planning services. We also wanted to support access to services at community level. So we supported the ministry to train women for self-injection of Depo-Provera, and we've managed to reach women of about 33,000 of them to get family planning and services. We also focused on WASH in terms of infection prevention in facilities, including at communities. So we've managed to support communities, 67,000 of them, to get access to basic water through repair of boreholes. And at facility level, we repaired, pipes that were not working, or we put in a new borehole to make sure that at least at the facility there is running water. For waste management at facility, we've invested through the project on the mechanical incinerators. I recall one day, Honorable Minister, you were saying that the policy of government is that each facility should have a mechanical incinerator. So the project has tried to do that. I've already mentioned about the boreholes at community level. But we are also mindful that strengthening the health system is quite good and necessary. So we invested in promoting governance and leadership for the district management teams. So we have supported implementation of 139 DIPs throughout the 6 years. And we have also capacitated the 339 health center management committees so that they should be part of the governance structure for health services at the district, also at health center level. Supervision is very good to make sure that the people are adhering to guidelines and protocols. So we managed to support the health management teams at district level to do integrated support and supervision using an electronic tool, but also managed to support health information system to make sure that we are collecting good data that we can use for evidence-based planning. So 380 facilities now are able to report timely on the LMIS, and also to make sure that the HMIS data is something that we can depend on as we go on. Lastly, but not least, communities, the owners, the beneficiaries, we thought that they should be capacitated, one, to demand for good care, but also that they should take part. So we supported 127 champion communities. You will see one champion community today to see what they were doing. We were also one of the partners that worked with each Pakataka Fund. You recall, Honorable Minister, So through the support of the youth project, 79,000 calls were made by people looking for information on what to do when they are sick. We have also supported communities to use the community scorecard and interface between the community and the facility so that they can all be on the same wavelength to make sure that communities can express their needs and the facilities can meet those needs. And then lastly, this project throughout the 6 years, it has also shared with government the eventualities that happen, both the cyclones and then COVID. So although we did not have any plans, because you can never plan for an emergency, but the project invested heavily on a response to COVID. So we have supported through the project vaccination of about 613,000 people, but we were also supporting contact tracing. You recall at the beginning of the epidemic or the pandemic, one of the Onse people were nearly attacked at Kairekera when we went for contact tracing, but we also trained 1,000 health workers to be vaccinators. And then, of course, for risk communication, we're at community level to make sure that people know what to do in terms of prevention, in terms of getting the vaccine. And this is, in a nutshell, what the project has done. So I would like to take you, Honorable Minister and Your Excellency, to the pavilions to see one of the things that I have mentioned here. Thank you.
Honorable Minister, welcome. So for us to achieve all those figures that Dr. Poya was narrating to you, we've been working with the community structures as well as health providers, much as we also worked with the different partners. So today we have our colleagues, a champion community that will portray some of the activities, interventions that they've been able to do after we provided the capacity building and the achievement that they've been able to achieve. Thank you.
Zikomo kwambiri mwalangirirwa. Ine ndine Thokozani Sungeni wapa mpando wachiwandira champion community ndokera mboma la Dowa TM ponera kwa group achiwandira. Kubwera kwa Onse mu 2018-23 February anabwera ndi fundo folo zimene anakhazikapo kwambiri kunkhani ya zaumoyo madera akumudzi ndi uchembere wabwino, madzi ndi ukhondo, kulera komanso kadyedwe koyenera. Pamene tisanakhale a champion community ndikuti panali chagi patsogolo pathu, pamene chagiyo imagwira ntchito ndi amavolontiya osiyanasiyana ngati CBDA komanso a village health committee, water point committee. Chonsechi chinapangidwa kukhala chiwandira champion community kapena kuti ma champion community. Choncho ndiye kuti pogwira ntchito yathu tili ndi ndondomeko imene timasatira imene ndi community action cycle yathu imene muli fundo 7 zovomerezeka zimene ntchitoyo timayiona kuti iyende bwino. Pa nambala 1 pali kukonzekera kumemeza, ndipo tikachoka pa kukonzekera kumemeza timasonkhanitsa anthu pamodzi pa nambala 2 kuti atengepo gawo pa nkhani za kumoyo, ndipo pa nambala 3 pamene patimafufuza mavuto ndipo timapezapo limodzi lalikulu limene tingambe nalo kugwira nawo ntchito. Pa nambala 4 ndipo kupanga ndondomeko yakagwiridwe ka ntchito. Pa nambala 5 ndi kumema anthu aja kuti tigwire ntchito pamodzi. Nambala 6 timapanga kauniuni ya ntchito yayenda bwanji. Ndipo pa nambala 7 ndi pamene timakonzekera kupita chitsogolo ndikuona zofoka ndi zoyambitsa. Mamagawo folo amenewa ndizanga lodi zingalume kuti afotokozere za utembere wabwino mmene takhala tikugwira ntchito imeneyi. Sikumbabora.
Ine ndine Welodi Zingalume ndachoka kumene kuja fotokoza zangawa. Titakhala pasi pa vuto la uchembere wabwino napeza kuti vuto ndi imfa za amayi oyembekezera komanso za makanda. Titayiona tinakhala pasi ngati dera komanso anthu akumudzitengapo gawo. N'chifukwa chake kuti tinapeza zoyambitsa za vuto lalikululo. Vuto loyamba tinapeza kuti kutalika kwa mtunda wopita ku chipatala. Lachiwiri kusazindikira komanso zikhulupiriro kumudzi zimene zimapangitsa vuto lalikululi kuti lichitire mavuto za imfa ya ana amakanda komanso amayi oyembekezera. Ndiye titakhala pasi kusankha vuto lalikululo tinagula chinjinga kuphatikiza dera lonse imene limatengerapo munthu oyembekezera komanso kumuthamangitsira msanga ku chipatala. more adazindikira abantu tsopano kukhazikika posagwiritsa ntchito izi podzidalira okha akamfika mwezi wa 8 kuthamangira kuchipatala ngati kumponera pophatikiza pamenepa zoyendera pamodzi ndi kulera uyu kumene kuso kunali vuto la azimayi uchepa olenga njira zolera zamakono monga amene tikuonera apamu pokhala pansi pochiona chimenechi tinapeza zoyambitsa ndiye kusazindikiranso china chikhulupiriro kusatengapo mbali ife abambo nthawi imeneyi sitimadziwa njira zolera koma pano pokhala pansi pozindikira chimenechi dera la gulupu achiwandira kumponera ukhondo.
Zikomo kwambiri ine ndi Chikondi Matthews ine secretary wa gulu limene la Chiwandira Champion Community. Ndikufuna ndifotokozere za gawo limodzi m'magawo 4 la madzi ndi ukhondo. Kwathuku madzi ndi ukhondo umene tinkagwira ntchito kutsatira chingelengere chija community action cycle tinapeza kuti pali vuto pamenepa. Vuto limene limabwera ndelu kunali kuchuluka kwa anthu otsekula mimba. Ndiye tinaona kuti vuto limene lingatithetse bwanji mothandizana ndi alangizi athu a zaumoyo akanyenda komanso akunduna zaumoyo mukati kuonse tinapeza kuti pali vuto la makamaka zoyambitsa kumwa madzi osatetezeka komanso kuchuluka kwa makomo amene analibe zimbudzi. Ndipo magwira ntchito tilandira uphungu tinapeza kuti tinalimbikitsa dera lonse kuti likhale ndi chimbudzi cha makono. Pamene pali chimbudzi cha ukhondo taona mtsikana uya kusamba m'manja ndi sopo choku chimbudzi zimenezi zidathandizira kuti mchilidwe wa kuchuluka kwa anthu otsekula mimba uthe. Komanso tinaphunzitsa kusamala madzi. Kusamala madzi ndiye tinaphunzitsa kuti madzi aja asamale uchokera pa njigo komanso kufika ku nyumba. Ndiye kuti ndi njigo otetezeka moti kudera lathu alo mutati mubwere mudzapeza kusintha madzi amakhala otetezeka potunga komanso kufika ku nyumba. Mwachidule funda zimene zidathandizira kuti dera lathu chilengero cha anthu ochuluka otsekula mimba chitheretu. Zikomo kwambiri.
Ine ndine Stelia Ngoma nabwera pano kufotokozera kadyedwe koyenera. Kadyedwe koyenera kwathuko vuto linali kuchuluka kwa anthu onyenchera. Ndiye titakhala pansi tidaona kuti tipeze zoyambitsa ndi chiyani limene talemba m'musumo. Tinakhalanso pansi tipeze za masamba ndiye tinamba kulimba timadimba tija ta makomo ngati zonse momo. Tinaweranso nkhumba izi kuthandizira thanzi lija kotero kuti lero kwathu kwa Chiwandira kulibenso munthu wonyenchera pano ndi thanzi limene tinaphindula ifeyo. Zikomo.
Mwachidule nabweranso ndimangofuna ndifotokozere mmene zinalili zinthu pachiyambi kufikira pano amene ndiye kalozera wathu. Choncho mwachidule ndiye kuti nali ndi mabanja 162. Titayamba mwantchito zosafotokoza zangawa ndiye kuti pachiyambi uchembere wabwino. Pachiwerengero chimenechi ndiye kuti peza kuti anali azimayi 8 amene amatsatira njira zakulera imene imatipatsa 5%. Choncho ndi chiwerengerocho timaona kuti sipanachitidwe bwino koma titayamba kufotokozera kuphunzitsidwa dera lija tinakakwera kufika pa azimayi 87 amene atengako mbali imene ikuonetsa kuti ndi 56% pa 100. Koma sipothera pathu masomphenya athu timafuna pa mapeto pa chaka chino oyambira kwa chaka chamawa ikhalebe 100% sonyeza ngati tachita bwino. Pamadzi ndi ukhondo monga anafotokoza kale pamene timayambapo ndiye kuti makomo amene anali ndi zimbudzi ndi 83 pa 162 imene imatipatsa 51%. Koma titaphunzira kuyenda khomo ndi misonkhano ndi zina zotero zinakwanira khomo lilonse lili ndi zimbudzi kotero kuti mabanja 162 tinapatsa 100% imene ionetsa kuti tachita bwino. Kukadyedwe koyenera monga fotokozera titaphunzitsa mwa ana osapitirira zaka 5 titalolera data timakapeza kuti dera lonselo chiwerengero chake ndi ana 66. Komabe pa ana 66 timakapeza ana 5 amene amanyenchera kuthokose kwa chaka. Koma titapeza kuti ndi maperesenti angati imakaoneka kuti ndi 80% imene chinali chiwerengero chokulira ndi deralo. Koma si masomphenya athu tinakaona kuti pamene sikukwanira titaphunzitsa njira zonse zotsatira pakadyedwe koyenera chiwerengero chija chinatha kotero kuti pali 0 imene ipereka 0% tanthauza kuti deralo fikira pano palibenso amene ali onyenchera mwana ngakhale wamkulu. Ntchito yonseyi yagwirika ndi kuthandizira ndi chithandizo chochokera ku onse kudzeranso kwa alangizi athu a zaumoyo ndi mawu amenewo ngati pali mafunso mukhazofunsa nduna. Zikomo kwambiri.
Tathokoza. Thank you so much. Just in summary, So this is one of the champion communities. They have come from Doha. They have described the process that they've gone through using the community action cycle. They've been able to identify the priority problems and work together with the committee members to come up with the solutions right from the community. And they've been able, for example, to procure a bicycle ambulance, which is currently helping to move women with complications or newborns with complications to the hospital. They mentioned in Ponera Hospital. They also had issues of family planning, but now, as we have seen the figures when they were explaining, there have been a lot of improvement. Of course, they want to reach 100%. In terms of water and sanitation, now they have 100% achievement of households that have improved their drains. But they have also worked on issues of nutrition. For them to be able to have 6 food groups, they've been able to have backyard gardens. They've encouraged their communities to have backyard gardens, but also to raise animals. So some of them are doing pig farming, so that from them they can be able to sell some and be able to buy foods for other food groups like oil, like fats. But they can also use the pigs for meat and vegetables for food, for the vegetable group. So they are now capable of preparing the meal that is well balanced. Thank you. So at this moment, we have worked with the communities to create demand. Now they are coming to the facility. What are the services that are finding? So within Onse, we've been working to support increasing access to quality evidence-based services. So that's what we'll be showcasing now. Thank you. Welcome. Over to yours.
Thank you very much, Honorable Minister and Your Excellency. Welcome to the second pavilion, which is increasing access to priority health services. This is mostly health facility-based services, including community. So over to the Machinga team.
Welcome, Honorable Minister. In this second pavilion, we are showcasing how we demonstrate the application of non-pneumatic and shock gametes. This is a woman who has just delivered and is bleeding profusely. She's having postpartum hemorrhage. I'm Jessie Dawa, a nursing officer from Machinga District Hospital, and this is Lucy Mayuni, a clinical officer, Mbuto Yasros Limbire, nurse midwife technician. A key component in managing hypovolemic shock is to ensure that the available blood is directed to the upper part of the body, to the vital organs, which is the brain, the heart, the lungs, and the kidneys, to ensure that they continue to receive oxygen, which will prevent the woman from organ damage or death. To achieve this, we need to make sure that the woman is positioned in Trendenberg position, where the head is lower than the hips and the feet. But the most effective way to ensure this is by the application of the non-pneumatic and shock gamete, the NASIC. A NASIC is a lightweight compression suit, about 1.5 kgs, which is made of neoprene. It has 6 segments that closes at the ankle, at the calf muscles, the thigh, the pelvis, and the abdomen. This shock gamete interlects the blood to the upper body. It has viscofasteners, which helps to keep the gamete tight on the woman. I hand over to Lucy to continue.
All right, thank you. So we are going to take you through the process of applying NASIC. As you can see, our woman is lying on top of the NASIC. So on the upper part of the NASIC, it is placed below the lower lip of the woman, and here it goes to the ankle part of the woman. So we are going to be demonstrating, and so we are starting from the ankle part. It has got some markings, so we are just following the markings as we are applying it. It is something that is done by 2 people, and we are doing it simultaneously. So we are making it very tight. At the end of it, we snap it, we need to hear the sound, the sharp sound, so that we know it is titrary on the patient. And we go to the second, it's the same. You snap it, you need to hear that sound as well. On the knee, we need to leave the knee joint flexible so that the woman can be able to be bending. And we tighten the thigh segment. And this one, the pelvic segment, it is done by one person so that it is really tightened up. You do the same, you snap it, it's tighter on the woman. And the segment, this is a pressure ball. So this pressure ball is pressed on the umbilicus of the woman because this woman has just delivered. So we are targeting the uterus at this time. So it is pressing the uterus. And then you do the same and you snap it. If the patient is conscious, we'll be asking the patient if he's able to breathe. But if he's unconscious, we'll just be seeing how the patient is doing. This allows us to buy time. We can do a lot of things, investigations, we can perform surgeries, we can do the perineal tear, we can repair them, we can do manual evacuation and manual removal of placenta because we can position this woman in lithotomy position, so we can do a lot of things. As we are doing this, we are also monitoring blood pressure and pulse rate. So this is all about NASIG. Any comments or questions? Because we are targeting the blood to push it to the top. Yes.
Okay, so I welcome you, Honorable Minister, to helping babies breathe. In fact, that woman has just delivered a baby who is not breathing. So the first minute of the baby's life is very vital. We call it a golden minute because we want the baby to initiate breathing on its own from that first minute. So if you deal with a baby who hasn't started breathing, you need to initiate it in that very first minute. So I have a friend here. I'm Elizabeth Timvere from Chireka Health Center, and I'm with my friend Friday Chanyenga. We want to show you the techniques that we use to resuscitate this asphyxiated baby. Thank you.
Welcome, Honorable. So this baby, as said, is not breathing, has been just delivered. Now what we do is, once we deliver the baby, we take the baby and put on the mother's abdomen. Immediately, we look into the mouth if there are meconium, called the fluid which. So when there is meconium, we immediately remove that using the penguin sucker. So we start from the mouth, then nose. And we continue looking at it and assess if the baby starts breathing or if the baby cries, that means we continue with the routine care. But if the baby is not crying, we continue with the rubbing or cleaning, drying up. As we are drying, we are doing also stimulation. So this drying will cause the baby, as the friction on the back will cause the baby to cry or starts breathing. So after we dry, this is wet, we put it aside and we assess again. If the baby starts breathing or if the baby is not breathing, we cover it. But before covering, we tie the cord and cut it. So we have these which we call cord clampers. So when we tie, we cut the cord.
So thank you so much, our providers. So they've received this capacity, and within the project, we've been able to resuscitate over 40,000 newborns that were born and they were unable to initiate breathing. So these are just trying to demonstrate, but all the districts that we worked in, the providers received this capacity. I want you to also experience another intervention.
Welcome, our Honorable Minister. Also, Onse has been supporting a lot in Salima DHO, and some of the things we are capacity building, trainings, and also supportive supervision, and also even mentorship. So some of our community activities which Onse helped us is a village clinic, and also provision of our community family planning. That is Sayana. So I hand over to you, Mark, to explain about village clinic.
Welcome, Honorable. My name is Mark Chakubika from Salima. I'm presenting village clinic level. So at the village clinic, we are dealing with under 5 kids, but we are having this through. This is mainly our guide. We call it sick child recording form. So at the village level, we are trying to treat 3 diseases. These are pneumonia, diarrhea, malaria. So here in this box, we are having some sort of drugs that I want to show you. When the kids is having diarrhea, we are using this drug. We call it ORS, zinc supplement. If the child having fever, we are using MRDT for testing malaria. So if the kids having malaria, we treat using La and paracetamol. In short, after conducting the village clinic level, we are having these registers where we record the kids in this register. After all, if the child have a danger signs, we are having referral. So here it is. Then after month end, we do write the report where we use to send at the district level. So that's in short at the village clinic. Thank you.
Thank you so much. I think in the interest of time, we had a lot to show you, including interventions for self-care, for family planning, for nutrition, but I think we can proceed to view other interventions. Thank you. Thank you. We will not stop here. We'll just talk as we pass. So, yeah. Say hello.
Okay. All right. This is a Zomba team doing quality improvement. As you know, as a country, we've done very well in terms of accessibility to healthcare, as you have appreciated in the previous pavilions. But then in terms of quality improvement, we have not doing very well. So with support from Onse, we've done several quality improvement initiatives through Quality Management Directorate, and we are implementing using the quality improvement model from Malawi, of which the basis is making sure that we have a very conducive environment for the clients as well as patients, including us, the health workers. So here are just few pictures just to indicate some of the efforts that we have done as a district. This is one of the facilities, Nassau Health Center, where most of the environmental health offices are congested, considering that they have lots and lots of staff in a small office. So we've made efforts to make sure that we sorted that office up until we reached this far, where we assist our women as well as children who come for vaccinations easily. And also on step 2, we have quality improvement projects that we have also worked on. So my colleague will take us.
Thank you. My name is Onse. I'm a nurse midwife from Nassau Health Center under Zomba Decho. So as part of quality improvement, we are also aiming at the goal that we are supposed to improve or to decrease the complications that arise to the newborns as well as to the mothers. So soon after delivery, we noticed that most of our mothers as well as newborns were having complications. And when we assessed our data, we realized that it was mainly because we weren't using the ideal or recommended postnatal assessment or routine care. So we had to come up with a project so that we should encounter that problem. And our baseline was at 12%, as you can see, and we were aiming that we should at least reach up to 80% as our target. So in order to fulfill that, we had to use several interventions that we had to partake. So we had to fill out the knowledge gap that was there between the nurses and midwives. We also had to derive a postnatal tool, which was derived by the Matawale Health Center, one of the QOC facilities. So this was the tool that we were using instead of using just the photograph so that we should fulfill our goal. And we also had to allocate team leaders as one of the interventions so that this team leader should be able to remind fellow midwives on what they are supposed to do. Regardless of our achievements, we were facing some challenges during the project. That is increased number of BPS. So as we know, BPS come at every time whenever they can come. So it wasn't really time bound, but we still managed to put an intervention that all nurses and midwives should still do the assessment regardless of what time the BPS have arrived. And in encompassing shortage of stationery, we also had to use the nearest facility that we had. And we've managed to come from 0% up until 80%, and up until this month, we are still up until there. Thank you.
Thank you so much. So now the facilities are able to look at their data, use it, and make meaning of it. So we also worked on strengthening health systems so that these services should be able to be provided. Over to you.
Welcome, Honorable Minister and Your Excellency. This pavilion is for health systems strengthening. And in health system strengthening, Onse supported areas of leadership and governance, planning. We also supported data management, but today we are going to showcase under leadership and governance on Health Center Management Committee and integrated supportive supervision. Our colleagues from Mchinji and Idoa will take us through. Thank you.
Once again, welcome, Honorable Minister and your team. I'm Owen Jataiga, Health Promotion Officer for Mchinji Decho.
Ndakulandirani, ine ndine Josephat Julius, amene ndili wa pampando wa Health Center Management na Mizana Mchinji.
Victoria Levisoni na Mizana Sector.
Watsoni Kachikayo from Doha DSO, ISSC Supervisor.
Well, another area which the Minister of Health has benefited a lot from support from Onse is the leadership and the governance. Under this one, Onse has assisted the Minister of Health to train 339 health center management committees across the country in 16 districts. And they are now able to plan and implement some activities at the health center level. And they are now able to support the health management in the running of the health centers at that level. So for more details, I hand over to the chairman of Namizana Health Center Management Committee to tell us more about that.
Ine ngati wa pampando wa Namizana Health Center Management Committee. Bunge limene komiti imeneyi nimene imendesa chipatala, imene imaonanso pulani cha chipatala. Choncho ife tinakwanitsa kupanga pologalamu yathu kuti tipemphe ndalama yopangira chipatala chathu monga mukuona kumanja kwangako. Kuyambirira chipatala chathu chinakasuka, kenaka ife titaona chakasuka tinapanga pologalamu yoti tipemphe thandizo. ndipo thandizo limeneli tinapempha kuchokera ku polisi. Apolisi atatithandiza, tinakwanisanso kupempha kwa MP athu, tinakwanitsa kupanga chipatala monga mukuchionachi. Kenaka kunapeza kuti tinali mavuto ambiri makamaka ana osachepera zaka 5 amene apangira sikelo pa mtengo. Tinakwanitsanso ife ngati akomiti kupanga shelter mukuiona payi kuti ana azikwezerapo sikelo. Iyi ndi ntchito ya komiti imene ifeyo timagwira. Choncho tikupitirizabe kupempha choncho, tinakapemphanso kwa MP komanso ku polisi kumene anatipangira chipatala cha under 5 clinic monga mmene mukuonera pano. Iyi ndi ntchito yomwe komiti yapa chipatala imagwira. Ndiye pali zina zambiri zimene ndasiyako ndi sekretary kunayenso alankhuleko.
Komanso tinakwanitsa kumanga chimbudzi, tinadzala mitengo yokwana 550 kuzungulira chipatala chathu kuopetsa mphepo. Kenako tinapanganso kumba dzenje lotamo zinyalala. Zikomo.
As I was saying, that I'm one of the supervisor under ISS, that's Integrated Sport Supervision in our district. In the past, we were using papers which made our work very difficult. Then later, with the coming of Onse, they supported us with the gadgets. So one of the gadgets is this one. So these gadgets has made our work to become simpler. At the same time, these gadgets has made our work so that we have able to follow the action plans. At the same time, have made our work to follow action plans, as I've said, as well as to implement for those action plans. Therefore, we thank Onse for the support of the gadgets. So we supervised different programs, for example, leadership and governance, logistics and management and supply. At the same time, we also supervise HIV and AIDS, as well as maternity. Those are some of the programs that we use to supervise. These programs are being done every quarter to all districts. Thank you very much.
Thank you indeed. For integrated supportive supervision, results are real time, unlike the paper-based, where they had to go supervise a facility and analyze the data to find out how the indicators are moving. But this time, they are able to produce results real time and brief the staff at the health center there and then and agree on the action points. And when it is also posted in the gadgets, there is a dashboard that everybody can access as long as you have internet to find out what are the issues for a specific facility and how they have resolved it. Thank you very much.
Thank you so much. Now we want to see how Onse has worked with the Minister of Health, your Ministry, Honorable, in order to strengthen issues of infrastructure as well as water and sanitation at facility level. We have our colleagues from Lilongwe and Mulanje.
Welcome, the Honorable Minister and Your Excellency. Here is WASH, and WASH is in 3 parts: facility, water supply, and sanitation, infrastructure, and community health. So we have got our friends who are from our partners from Mulanje District, Mulanje District, as well as Lilongwe District. So
I'm Msisia Eho from Mulanje DHO. Welcome, Honorable Minister and Your Excellency. As he has already said, Onse has assisted us a lot when it comes to WASH activities. But in a snapshot, I'll take you through a demonstration of a health facility that has been reticulated with water. We have a demonstration of a facility here. This is a facility, and these are staff houses. We have a borehole here that has submersible pumps that are powered by either solar or ESCOM electricity. These pumps pump water to storage tanks that distributes to the whole facility, and people can use when they have come for services. And again, when we go to the communities, we have done a lot. One of the things that we have done is motivating and empowering community members. We have ladies, these two ladies are Masons from Mulanje, and we are promoting people to move from basic latrines to improved latrines using affordable resources. Due to time, we could have given them time so that they should explain, but thank you.
Anga ndinefeli yakanyizira timamanga adzimbuzi chokoza kwambiri kwa aonse kukweza bungwe limeneli mokwizana ndi achipatala. Ine ndi mmodzi wa byoda amene ndimathandizira nawo kumanga matoileti amakono. Awa ndi matoileti amene samatha simenti kwambiri chifukwa thumba limodzi timagwiritsa ntchito kudzimbuzi 4. Chimakhala cholimba komanso cha ukhondo. Tindi flava iyo imene ili apo munthu amene angakwanise kugula amagula timabwera ndi kumangirira.
Thank you so much. This is Kinlos Jelly from Lilongedecho, working as a maintenance supervisor. Yeah. Thank you so much, Honorable. I will just take you through some of the items, like in terms of rehabilitation in our area, Lilongedecho, and throughout other institutions in other districts also. So I will just take you, we have many which Onse has, we has benefited from Onse project. So previously we had no, as you can see from the picture, we had the facilities which they were in bad shape. As you can see, the ceiling, they were in bad shape, but Onse has really did a very great job to assist us. And as you can see now, the hospital beds, they were in bad shape also, but through, as you can see here, I can take you, these were the conditions before. Now, after Onse assistance, that's how it has been all along. And secondary, I can also take you to pit latrines. They have helped us with the pit latrines, boreholes, and also sanitation infrastructures. As you can see, this is how the situation was before Onse. But as you can look from at the pictures, you can see a very great work which Onse has given us. And also we have other areas like disposal, waste disposal. They have given us mechanical incinerators, very big ones, as you can see, of which before, when we had our waste, they were not in, we were not having a complete combustion. But with the help of Onse incinerators, we have now complete combustion with our waste. And I really appreciate so much for the project because it has improved our skill capacity, because they utilized our workmanship through our plumbers, all the maintenance staff, electricians, and or have you builders and so forth and so on. So we really appreciate because they've shaped us, they've increased our capacity in terms of skills because they utilized our team at the DHO to work on all of these in our institutions. So we really we are urging other organizations when they are coming with their project, we really urge them, please utilize us because it will also increase our skill capacity as well as financial assistance also. Thank you so much. This is what Onse given us. Really appreciate. Thank you.
Thank you so much. And finally, Onse has also been supporting, responding to public emergencies and COVID-19. So where we are now, this is a hospital, a clinic, an outreach, where there is a live demonstration of COVID-19 vaccination. Some of us will receive our booster doses today. Thank you.
Welcome, Honorable Minister and Your Excellency. The pavilion here is the vaccination site, as you can actually see, and we are ready actually to provide vaccination to all those that are willing to get their boosters and even their first doses. We are ready to do that today. Honorable Minister, the Onse support towards public health emergencies has been very much comprehensive and also complementary to the government of Malawi efforts in actually preventing and controlling COVID-19 and also other pandemics like for example, cholera. Also, we had polio and also neonatal tetanus. And Onse was there with the support, and the support was really timely, as already alluded by the COP. Let me not take much of your time. I should hand over to the district EPI coordinator for Lilongwe, Mr. Maclean Homer. So,
thank you very much, Dr. Utopi. Now, welcome, Honorable Minister and Your Excellency. Now, here we need to emphasize the importance that this Onse project has brought to this country on behalf of all districts. Now, what are the services that Onse supported? One of the services, COVID vaccination, capacity building, that is in all immunization services, routine as well as these emergency immunizations. Support of supervision, infection prevention and control. We also have, some of these immunizations brought resistance to the community. And also Onse provided support for risk communication and community engagement. Now also, due to the disease was just new to Malawi, like the COVID-19, there was also surveillance. We are looking at rapid response teams, disease investigation, and case investigation as well. So on emergencies, like in 2018-2019, we had a cholera outbreak in Lilongwe, and Onse pumped a lot of support. We did disease surveillance as well, but plus mass coordination, and also that was port-to-port coordination. And also they did a lot of boreholes. If you go to Kangoma and to Temas, you'll find that there are also gravitational water that people are now using taps because of this Onse project. And also our friends in the south have got flood disasters. So also all these have supported. And today, not only that, because of that partnership, we say, let's come and do the vaccination at the site as people are witnessing the activities that Onse has implemented. We are also having vaccination sites here. Those that need booster doses as well as second doses here. We have got two types of vaccines. We have got J&J and Pfizer. So today, this is their chance they can still get the vaccines. Thank you very much.
thank you, Honorable Minister and Your Excellency, for visiting our site. Thank you.
Thank you so much. You are free now to be led by Dr. Poya. As those that are willing to get vaccinated, you are very much encouraged. Thank you.